Essentials of Pharmacology for Health Professions, 9th edition. Chapter 19, Central Nervous System Drugs, Analgesics, Sedatives, and Hypnotics. Please keep in mind this is a summary of the chapter. You can enhance your knowledge by reading the ebook or your textbook. Chapter Objectives. Upon completion of this chapter, the learner should be able to explain the indications and actions of non-opioid, opioid, and adjuvant analgesics, describe sedatives and hypnotics and their place in sleep, list the side effects of the major analgesics, sedatives, and hypnotics, describe the necessary information for patient education for analgesics, sedatives, and hypnotics, and explain the precautions and contraindications to administration of the central nervous system depressants mentioned in this chapter. As you learned in Chapter 13, the central nervous system has many functions. Analgesics, sedatives, and hypnotics will depress the central nervous system action to varying degrees. Some are classified into more than one category, depending on the dosage. There's 5 categories of the central nervous system medications, and they include analgesics, which are used to relieve pain, adjuvant analgesics, they're given to enhance the effects of analgesics, anti-migraine agents, and they're given to prevent or relieve migraine headaches. Sedatives are given to calm, soothe, or produce sedation, and hypnotics, which are given to produce sleep. As I previously discussed, the analgesics are used to relieve pain, and pain is the most common reason patients seek medical care. The 4 most common types of pain include lower back, neck, migraine, and facial or jaw pain. Pain is subjective, or is perceived only by the individual person. Pain has both psychological and physiological components, and some people have a higher pain threshold or pain tolerance than others due to conditioning, sensitivity, or physiological factors, such as an endorphin release. Endorphins are analgesics that are produced within the body. They're endogenous as a reaction to severe pain or intense exercise, such as the runner's high, and they block the transmission of pain. Patients can experience acute pain, which is mild, or chronic pain, which is more severe, and healthcare professionals can assess their pain by asking them to describe the pain and its location and assess the pain severity by using a valid pain assessment scale. Pain scales are often based on a range of 1 to 10, or they use a symbolic facial expression to show the levels of pain, such as in the picture on this slide. You see a facial pain scale is used by the healthcare professionals to assess the pain at the time of admission and to assess the changes in pain levels. Opioid analgesics are very effective in providing pain relief. They are classified as full, partial, or mixed agonists, depending on their activity at the receptor. Full agonists are commonly used because their action is like that of opium in altering the perception of pain, and they do not have a ceiling to their analgesic effects. This means there's no plateau to the amount of analgesic relief, and the only limiting factor is side effects from higher doses. Due to their potential for abuse and psychological dependence, all opioids are classified as controlled substances by the FDA. Opioids tend to cause tolerance, which means a larger dose is needed to achieve the same level of analgesia, and psychological dependence, which is physical adaptation of the body to the opioid and withdrawal symptoms after abrupt drug discontinuation, and that's with chronic use. For acute pain management, addiction or psychological dependence is usually not a problem. For chronic pain therapy, example back pain, sometimes this includes a tricyclic antidepressant or anticonvulsant and added that to the analgesic regimen. Drugs that are added can enhance the effects, and these are called adjuvant analgesics. When you add one of these drugs, that can reduce the needed dosage of opioids. This table provides the common side effects, cautions, or contraindications of major opioid analgesics. The opioid analgesics side effects include sedation, confusion and dizziness, hypertension and bradycardia, nausea and vomiting, constipation, and please read the clinical application related to opioid-induced constipation. This is something that is another side effect, and because the digestive tract contains similar receptors and they're targeted in pain relief, this can cause problems with patients taking opioid analgesics. Other side effects include respiratory depression, physical and or emotional dependence, and tolerance. For tramadol, as an example of opioid analgesic, or Ultram, this is a centrally acting synthetic analog of codeine with only partial action at the pain receptors. Because it is a partial opioid agonist, it provides less pain relief than other opioids, but less potential for abuse or respiratory depression, and it's currently a Schedule III controlled substance. Side effect with that one is it can lower seizure threshold. Caution or contraindications for the opioid analgesics include head injury, and that's with conditions associated with increased intracranial pressure, cardiac disease and hypertension, CNS depression, GI, hepatic, renal, and thyroid diseases, chronic obstructive pulmonary disease and asthma, sleep apnea, pregnancy and lactation, children and older adults and debilitated patients, and there are a few others noted there. A note that we want to look at is the opioid antagonist, which is a reversal agent, naloxone or Narcan. It's used in the treatment of opioid overdoses and in the operating room, delivery room, and newborn nursery for opiate-induced respiratory depression. Non-opioid analgesics are available over the counter without a prescription. Very important for a healthcare professional to be informed and responsible for patient education with these medications. They are used to relieve mild and moderate pain, fever, and anti-inflammatory conditions such as arthritis. This group of analgesics is also used as a co-analgesic in severe acute or chronic pain requiring opioids. Salicylates or aspirin is most commonly used for their analgesic and antipyretic properties, or fever reducing, and for anti-inflammatory action. Ibuprofen is also an anti-inflammatory, and it is also used. Acetaminophen or Tylenol has analgesic and antipyretic properties but has little effect on inflammation. Aspirin and acetaminophen are often combined with opioids or with other drugs for more effective analgesic action. Two other non-opioid analgesics include local anesthetics and medical marijuana. Local anesthetics such as your lidocaine patch or lidoderm is approved for the management of postherpetic neuralgia. It can provide significant analgesia in other forms of neuropathic pain, including diabetic neuropathy and musculoskeletal pain such as osteoarthritis and lower back pain. Medical marijuana refers to legally prescribed cannabis or its synthetic derivatives, cannabinoids, to treat a disease with symptoms of chronic pain, nausea, and severe decreased appetite. It can also refer to traditional marijuana use, but prescribed by a doctor. This type is subject to laws and regulations of each state where there is much variation. Common side effects, cautions, or contraindications of major non-opioid analgesics include for the salicylates or NSAIDs, which would be aspirin. Side effects is prolonged bleeding time and bruising, gastric distress, ulceration and bleeding, tinnitus and hearing loss with overdose, renal insufficiency, and GI symptoms. Cautions or contraindications include GI symptoms, pregnancy and lactation, asthma, treatment of pain with NSAIDs after heart surgery. For acetaminophen or Tylenol, side effects include severe liver toxicity, is higher risk at higher doses or in patients with previous hepatic impairment, cautions or contraindications include hypersensitivities to acetaminophen. Your local anesthetics or the lidocaine patch. Side effects include erythema, edema, and hives, and allergic reactions. Cautions or contraindications include non-intact skin and sensitivity to local anesthetics. Medical marijuana or cannabis. Side effects include dizziness, feeling tired, increased appetite, and hallucinations. Adjuvant analgesics are those drugs that are intended for the treatment of conditions other than pain, but have shown effectiveness in reducing certain kinds of pain. They also have the ability to enhance the analgesic effect of opioids and non-opioids, produce analgesia alone, or reduce the side effects of analgesics. Common side effects of major adjuvant analgesics include, for the tricyclic antidepressants, they're used to treat fibromyalgia and nerve pain. Side effects with these is dry mouth, urinary retention, delirium, and constipation, sedation, and orthostatic hypotension. The serotonin norepinephrine reuptake inhibitors, or SNRIs, these are used to treat diabetic neuropathy and fibromyalgia. Side effects of these include sleep disturbance, headache, nausea, stomach pain, diarrhea, constipation, dizziness, and sweating. For the anticonvulsants, like Neurontin and Tegretol, these are used for management of nerve pain. For gabapentin, which is Neurontin, is considered a first-line anticonvulsant for neuropathic pain therapy. Side effects of these include sedation, dizziness and confusion, hepatitis, rash, nystagmus and blurred vision, weight gain with peripheral edema. Cautions and contraindications or interactions of major adjuvant analgesics include interactions with all SNRIs and serotonergic may result in serotonin syndrome. Cautions and contraindications would be caution must be used with anticonvulsants if used with allergies, hepatitis, cardiac disease, or renal disease, hypersensitivity, abrupt discontinuation, and psychiatric conditions. Knowledge check 19.1. Which analgesic category is used to treat mild pain and fever? Choose from one of the following and write your answer down, and you can check it at the end of the video. Case study activity. A 72-year-old patient underwent a total knee replacement. 2 hours after the surgery, the patient's evaluation demonstrated pain at level 9 based on the facial pain scale. Which analgesic would the provider prescribe? Choose from one of the following, write your answer down, and you can check it on the next slide. At level 9, this patient is experiencing some severe pain, one level below 10, which is the worst possible pain. For this situation, the patient would need D, an opioid analgesic. Migraines are the most common neurovascular headache and may include nausea, vomiting, and sensitivity to light or noise. Migraines and most other forms of headache respond best when they're treated early. Typically, patients who experience chronic migraines will have an aura before the migraine occurs that can help warn them a migraine is about to occur. The following represent medication treatment options for migraines. For patients that do not respond to simple analgesics, NSAIDs, serotonin agonists were developed based on the observation that serotonin levels decrease, whereas vasodilation and inflammation of blood vessels in the brain increase as the migraine symptoms worsen during an attack. Opioids can be effective, however, are reserved for refractory migraines that do not respond to any other therapy. This table discusses the side effects and cautions or contraindications of major anti-migraine agents, and they include the serotonin receptor agonists. These are for patients that are unresponsive to the simple analgesics or NSAIDs. They're also effective in treating the nausea and vomiting that's associated with migraines. Side effects: malaise, fatigue, dizziness, and drowsiness, asthenia, tingling, paresthesia, and flushing, and various cardiac complications. Cautions or contraindications: patients with cerebral vascular or cardiovascular disease, uncontrolled hypertension, peripheral vascular disease, and hepatic or renal disease, pregnancy and lactation, children, older adults who are more likely to have decreased hepatic function and more pronounced blood pressure increases are at risk for coronary artery disease. For the opioids, these are reserved for refractory migraines that do not respond to other therapy options. Side effects with these include malaise, fatigue, dizziness and drowsiness, asthenia, tingling, paresthesia, and flushing, and various cardiac complications. Sedatives and hypnotics. Now, these are medications that are used to promote sedation in smaller doses and promote sleep in larger doses. Insomnia is one of the most prevalent sleep disorders, and chronic insomnia is more prevalent in women and older people. The sedative and hypnotic medications should not be used for extended periods of time, more than 10 days, except under close medical supervision, because of the potential for psychological and physical dependence. In addition, these medications depress the REM, or rapid eye movement, or dream phase of sleep, and withdrawal after prolonged use can result in a severe rebound effect with nightmares and hallucinations. The use of barbiturates for sedation is restricted to specific, limited circumstances in which the patient can be closely monitored. Benzodiazepines have supplanted barbiturates as sedative hypnotics and have less potential for abuse. It's important to note that withdrawal effects are observed after long-term use, and respiratory depression can potentially be fatal. The common side effects of major sedatives and hypnotics include, for the antihistamines, blurred vision, dizziness, hypotension, confusion, and decreased coordination. For the barbiturates and benzodiazepines, or BZDs as they're known, like temazepam or Restoril, daytime sedation, confusion and headaches, increased risk of falls, dependence or withdrawal symptoms, sleepwalking and engaging in complex tasks. And for the melatonin receptors, they're not listed as a controlled substance, therefore the side effects are not prominent. And for the orexin antagonists, somnolence, which is a state of drowsiness or strong desire to fall asleep, or fatigue, sleep paralysis, nightmares or abnormal dreams, and hypnagogic hallucinations, which is imagined sensations that feel real. Cautions and contraindications for the sedatives and hypnotics include severe renal impairment, abrupt discontinuation, older adults, debilitated patients, addiction-prone patients, depressed and mentally unstable patients, individuals who have suicidal ideations or behavior, pregnancy and lactation, children, and chronic obstructive pulmonary disease and sleep apnea. This table contains important patient education for analgesic, sedative, or hypnotic drugs. Knowledge check 19.2. Chronic insomnia is more prevalent in blank. Choose from one of the following. Write your answer down and you can check it at the end of the video. Knowledge check 19.3. Which major sedative has a potential side effect of sleepwalking? Choose from one of the following. Write your answer down and you can check it at the end of the video. Knowledge check 19.4. Which is not included in important patient education for individuals taking sedatives or hypnotics? Choose from one of the following. Write your answer down and you can check it at the end of the video. Knowledge check 19.5. Which is not a caution or contraindication for an opioid analgesic? Choose from the following. Write your answer down and you can check it at the end of the video. This slide provides knowledge check activities, answers 19.1 through 19.5. Now it's time to assess yourself and see what you've learned from this chapter. This concludes Chapter 19, Central Nervous System Drugs, Analgesics, Sedatives, and Hypnotics.